Hi, I'm Dr. Bob Marima, and I'm coming to you today to try and help explain some of the further details regarding the email you just received. As you know from the lead-in email, there's a lot that goes into a successful bariatric patient. I've had the pleasure over the past 30 years of treating more than 15,000 bariatric surgical patients. And gosh, so many have struggled to lose the weight they wanted to lose. They've struggled with weight regain. And I'm sure if you're watching this, you may have some of those issues yourself. We've been searching for years for the right exact way to solve this problem. And I'm confident after years of using these techniques that we have come across the right answers for you. So I want to explain it a little bit more deeply so that you can understand what I'm referring to. I'm going to go ahead and screen share at this point, and we'll go into a presentation, a PowerPoint presentation that will help explain things. You know, they say a picture is worth 1,000 words, and we're going to go ahead and give that a try. So here we are. Um, So why, what, and when you eat matters. Weight loss through blood sugar stabilization. So what we're really talking about is, gosh, how many times have you heard calories in versus calories out? You have to take in less than what you burn in order to lose weight. Well, this does not work long-term for weight loss surgery patients. Our innate survival mechanism built into our DNA causes us to down-regulate our metabolism when we severely calorie restrict. This is in an effort to protect us from perceived starvation. If you think about it, over the centuries, there have been many societies that have suffered through times of famine and whatnot, and yet survived. And that's because our DNA has the ability to slow things down until food is available again. And that's even if we have plenty of calories stored in our body in the form of fat. So the basal metabolic rate is what I'm talking about. This is calories burned each day outside of exercise. Calories burned by your heart because it beats, calories burned by your muscles involved in simple everyday activities of daily living. This is the basal metabolic rate, and it decreases to meet our current calorie intake over time. So this causes us to need to eat less and less calories over time in order to lose weight. For example, a person who has a basal metabolic rate of 2,000 calories per day. Person eats only 1,000 calories per day. That leads to a 1,000-calorie deficit. That results in about a weight loss of 2 pounds per week or so. Because of our survival DNA, after 4 to 6 months of this eating 1,000 calories per day, at a basal metabolic rate of 2,000, our BMR down regulates. It shifts down to meet our intake. And now our basal metabolic rate is about 1,000 calories per day. In this situation, the same diet that we're on, the 1,000 calories per day, results in no weight loss, no more weight loss. This is why we say you're going to begin to see a slowing of your weight loss after about 6 months. And you may have heard that from your doctor. Well, we could decrease our intake again to 500 calories per day and create another deficit, this time of only 500 calories. And this might lead to a weight loss effect of, maybe now 1 pound per week. Well, how long can we sustain this where we gradually continue to reduce our calories? This is only going to last for a few more months, and then our body's going to down-regulate yet again. Essentially, it's an unsustainable method for continued weight loss or weight maintenance in the bariatric surgery patient. So what is the answer to this problem of down-regulation with calorie restriction? The answer is number one, try to eat a moderate amount of healthy calories, not severely restricted. And number two, use hormonal signaling to tell the body it's okay to release that fat. Don't tell the body it's starving. Tell the body it has plenty of food and it's okay to use fat when there's no food available. This is the secret. So how do we hormonally signal the body to release and burn fat? Well, if we keep insulin levels steady by avoiding large blood sugar spikes and dips, that's how we do it. Let me explain further. Insulin goes up when blood sugar goes up. The pancreas releases insulin in response to an elevation of blood sugar. This is for the purpose of forcing glucose to be pushed out of the bloodstream and into the cells where it can either be used for energy or stored as more fat. When insulin is up, the body is storing fat. Do you hear me? It is storing fat. It does that because there's already plenty of energy in the form of sugar in the bloodstream. And it's saying we have to get rid of the sugar. We've got to put it somewhere. So we're going to put it into fat. When insulin remains low and steady, it signals the body it's okay to give up fat to use for energy. What a fascinating idea. Here's what it looks like on a chart. Now, I know for some people looking at charts is scary, but keep with me here. If you look on the left side, the numbers go from low to high, and that's your blood sugar, your blood glucose. On the bottom line, what you see is a timeline, 7 a.m. to 7 a.m. Okay? So in the beginning, around breakfast time, you're going to eat some food and your blood sugar is going to go up. That's the red line. What happens in response? The blue line goes up. That's insulin being released, responding to that elevation of blood sugar. Blood sugar shoots high, insulin shoots high. Now, because the insulin is high, the sugar is going to be rapidly removed from the bloodstream, and your blood sugar falls quickly. Thus, your insulin level is going to fall quickly. In response to that rapid falling of the blood sugar, the body has to mobilize a little bit of sugar, and so you see the blood glucose level bounce up a little bit again, and then gradually fall a little bit more gently towards lunchtime. But as it's falling, you are noting hunger. Okay, now you're hungry. Now it's time to eat again. Boom, you eat. Your blood sugar rises, your insulin level rises. Let's say, though, that you decided to have, some form of fast food, which might be higher in starch or sucrose. Well, those are the dotted lines. Look what happens. An even faster rate of rise of your blood sugar and your blood insulin. It spikes even higher and falls even more rapidly. And it falls deeper. Look how far those dotted lines go down. So what you have is then the urge to have a snack. Well, this particular graph doesn't show a snack, but let's face it, that mid-afternoon, gosh, I could use something to eat. That's exactly because you had a rapid rise and a rapid fall of your blood glucose and then your insulin level. You come along, you eat a moderate dinner, and after dinner, your sugar finally falls, your insulin level falls, and you begin into the evening. You see this progressive fall of the blood sugar. You see this progressive fall of the insulin level. During all that nighttime, you're not eating, hopefully, you're not eating, and your body is beginning to use fat for your energy source. So that's kind of the concept of how we get to, if we don't keep stimulating the blood sugar elevation, then we can potentially solve this problem. Starch and simple sugar foods spike glucose the most. This is where the benefit of lower carbohydrate foods help prevent insulin from locking down that fat for use as fuel. Remember, when insulin is present, it is signaling, do not burn fat, let's make some more fat. And that's what we have to get past. So, as you know, so many of the bariatric programs will tell you, well, eat 3 small meals and 2 or 3 small snacks to make sure you get enough calories. And so you're basically eating constantly. Well, here's evidence of what happens. Your blood sugar level is bouncing up all day long, over and over and over again, even late into the evening. And what we've learned so far, that means your insulin level is going to be bouncing up and down over and over and over again. It's going to be elevated. This is not helpful when it comes to the hormonal optimization model. It's not helpful in what we are trying to achieve, signaling the body it's time to lose. So intermittent fasting is the concept of consuming all of your calories in a smaller time window during the day. When you eat matters in the hormonal method for weight loss. So we might start off with a 12-hour eating window and a 12-hour fasting window. When that begins to become less effective, we might go to an 8-hour eating window and a 16-hour fasting window. I myself am on a 6-hour eating window and an 18-hour fasting window, and I'm quite happy with that. This means that for a full 16 hours of the day, you are not raising blood glucose or your insulin, and therefore signaling the body to use fat for fuel. Added benefits come from choosing the right types of food during your eating window. We talked about that briefly before. Foods that won't dramatically raise your blood sugar, things that are low in starch, low in sugar. But you want to be sure you're consuming enough calories. During that eating window, you want to provide enough calories to tell the body you are not in starvation mode, but not too many calories. In other words, it's not a trip to Dunkin' Donuts or a trip to McDonald's for a Happy Meal. What happens to your body when you don't eat for 16 hours? Fascinating things. You stabilize your insulin level. This may, prevent or reverse diabetes. You give your body more energy. You get more done. You have more fun. You lower your triglyceride level and prevent Alzheimer's. That's right. I said prevent the destruction of brain tissue. You stop sugar cravings and hunger pains. You boost you boost growth hormone. Growth hormone is known as the secret to longevity and to youth. So growth hormone is very important in slowing the aging process and improving your health. You dramatically reduce the risk of chronic diseases. You reduce free radical cell damage. That's one of the main focuses for decreasing your risk of cancer. Your brain actually functions better. You have a sharper mind, less risk of diseases of the brain and of the aging brain in particular. So let's wrap this up by telling you that bariatric surgery is the most effective tool for weight loss available today. Hands down, widely accepted truth. But severe calorie restriction is scientifically proven to lower the basal metabolic rate when used for a prolonged period of time, as in the case of bariatric surgery. So in my experience with all these patients over 30 years, this is the most common basis for failure to lose adequate amounts of weight and failure to maintain that weight loss after bariatric surgery. There has to be a better way, and there is. It's to counteract this phenomenon, we can use hormonal signaling to promote the use of fat as your energy source. This leads to weight loss and numerous other health benefits while preserving a higher basal metabolic rate. There is a better way than the continual cycle of weight gain and severe calorie restriction. I guarantee you it works. I've used it on many patients. I use it myself. It is going to become, I guarantee, the science that answers this question. Listen, I appreciate your time in listening to this. I know it got a little bit lengthy, but I hope that it helps you to understand what your potential future could be if we make some small to modest changes in what you eat, when you eat, and how you eat. So thank you for your time, and I look forward to seeing you in our next segment. Thank you.